Hello everyone, Dr. Renata von Kool here. I will wait you guys to come. I'm so excited to announce that Dr. Mikel will be here with us. We're starting again our lives, I hope every 15 days, coming up with some functional organ functions and talking about gut, about inflammation. Today we're gonna be focused on liver function and gallbladder. So I'm really excited that it's something that I had suffered in the past. I still don't have my gallbladder, and it's something that people are coming asking questions. More and more patients are coming with it, with gallbladder issues. So we're going to be very interesting to have Dr. Mikel here with us today talking about it. So I'm very happy to have you guys here. I will wave to all of you. Dr. Mikel will be soon join us. He is the creator, the founder of ANF therapy, which I've been working for almost 4 years now. Has done miracles to my life and to many of my patients. I can see Dr. Mikel has entered here. I hope you can. Then Dr. Mikel sent me a request. Well, let me see if I can invite you here. Just guys, be with me for a minute. I'll just invite Dr. Mikel. Let's see. There we go. I sent you. So thank you guys for being here. Yes, don't forget to give the hearts. Beside to invite more people. There he is.
Hello, nice to see you.
Hello. Nice to see you too. How are you doing?
I'm doing fine. And you?
Good, good.
Good in Dubai?
Yes, it is cold in Dubai. It's been colder. Now it's a little bit cold, but nothing comparing to Europe, as I was in Ireland, freezing. Here it's just a nice cold.
Yeah. That's a different story, eh? No, here it's getting warmer and warmer. It's nice.
Nice.
It's really, yes.
I used to be there with you guys at the academy.
Yeah, it's very nice here. It's amazing. Even though it's lockdown, but it's still nice. It's a good place to be in lockdown.
Sure. I'm sure it is, especially with the space you guys have at the academy.
Yeah, for sure.
Really, really good. We can't complain. And then we take time and technology. I always been awful with technology. Now I'm learning. So we can use and help patients as well to educate and making them aware of, how they can improve their health and knowing there is a hope at the end of the tunnel. Because we see a lot of alarms, and people say, oh, this is it, and you have to do it. And as my patients already, and people who are treated by us, they come and then, just connecting the dots, we manage to bring up health again to patients. So thank you so much for being here. Today we're going to be talking about general gut inflammation, which a lot of people has been asking about, but trying to focus on liver and gallbladder function. As I mentioned before, so many patients coming that they want, they were advised to have the gallbladder removed. And I had my gallbladder removed when I was 10 years old, as you know me. And every doctor who tells me you don't need the gallbladder, I always joke and say, please go remove yours and then you come and talk to me. Because God doesn't do any organ if we don't need it, and it's a big challenge in the body when we have it removed. So I will now stop the comments for a little bit, and so at the end we open for questions, but we're just gonna have a bit of chit chat. Thank you, Claudia. Let me just disable here now the comments. Let me try. Okay, turn off commenting for now. Good. So I don't know if you can see me properly. For me, you're a little bit blurry.
Oh yeah, I can see you.
Yeah. Okay.
Yeah. It's probably because the light here in the office. I see if I can make it better. Is that better?
Yeah, a little bit better. I think maybe it might be the connection. It's a little bit of
Could be, yeah. I see you perfectly.
okay, and we can hear you well, so I hope it
Yeah.
goes well. And I hope you guys who are here and you know, can share this live and start inviting your friends along so they can benefit from this chat as well. But yeah, so let's talk a little bit of gut. We have a saying now that the gut is the second brain. And it's another thing I used to say to me as I had gut issues, is the first brain. Whenever the gut is not working properly, you can't think. So tell us a little bit how ANF therapy sees the gut, and let's go from there.
No, it's not only the gut. I mean, when we talk about the stomach, most people is always thinking about the intestines or the digestive system, or I need to eat, and all this kind of stuff, without really understanding what everything is doing in the gut. Because I would say maybe even the stomach and the gut and that area is our first brain, and the real brain is probably the secondary. Because one thing is that the main brain is doing to control movements and stuff like this, and constantly actually doing what the nerve system tells. Another story is the stomach. Because when it comes to our immune response and immune system, the first priority is always to protect our stomach and intestines, pancreas, liver, because here we have the areas where most of our most important amino acids and cells is actually producing. And also when it comes to the large column, if we talk about gallbladder, we can come back to that, is producing many different amino acids that's important for the muscle mass and the muscle tissue, the ability for the muscle to recreation by the ghrelin. And if that doesn't work, you can also get Endler syndrome and other severe autoimmune diseases. When it comes to the female body, even more important, because that the female body is 100% done for reproduction. It sounds maybe a little bit nasty, but it is, and it's much more complex. And a lot of female, when they talk about hormones and stuff like this, is thinking about estrogen and progesterone. But if a male body have like 1,000 different chemical cells or hormones, the female body have 10 to 20,000 for ability to be as it is. And that makes that the immune response is protecting our stomach and in the soft tissue area, all these organs here, more than anything, because they have so many main functions that is really, really important for us to work normally. And yeah, I can take it how deep you want. It depends on how many hours we're going to talk.
Well, for me, we could be hours here. I don't want to know that it's a weekend here, and I hope we can go serious into the, you know, talking about, because it's a lot to information. But yes, so we know, like with ANF, and well, you know, like as you taught us to do surgery with our hands, and as soon as we start touching the patients and doing all the gut thing, they're like, wow, I didn't know I have that much pain. I didn't know that it's so. And you know, one of the things that I always when I'm treating the patients, I never let them go out without is the liver. And so and they're all like, why my pain is here, why are you treating my liver? And so let's talk a little bit about this big organ that has more than 500 functions as far as we know. And it's one of the most beautiful, most complex into the full system. Yeah, we have the bio that it's so important to breaking down all the enzymes and the fat and everything to later be absorbed in the gut. And when this is not working properly by the toxins that we have in the world, like from the air we breathe, from the food we eat, from everything, that it's the medication, yeah, that takes so long into our liver to be cleaned out if we have a good lymph. So yeah, talk to us a little bit about you know, how do you see the liver, the breaking down hormones and
So how many days do you want us to be here? Now the
No, it's a
liver,
quick one. We're trying to, you know, just give
yeah,
some
find the most
information.
important. Yeah. So
Yeah.
the liver is probably, oh, I would say the liver is our most important organ, and you have you can take most of the autoimmune diseases is actually related to that the liver doesn't work. And if you talk about non-fatty alcoholic liver that is affected by lipid peroxidation or inflammation or any other disorder, the liver has, as you said, more than 500 specific functions. What people don't really realize is that the liver is actually not only detoxing us from massive things like pharmaceuticals together with the lymphatic system, but what they don't understand is the collaboration the liver have with all our organs when it comes to regulation of many things. One of them is, for example, that's the only organ that have a direct connection to the central nervous system. We have a nerve directly from liver to the brain. And if the liver cannot work properly as it should be doing, and that means also that we have a lot of massive toxins from the liver that can be spread through the nerve system by creating neurologic inflammation. This can, in that case, also create that we get negative lipids, dangerous lipids that is coming to our brain and destroy our neurons in the brain that can give us Parkinson, Alzheimer's disease, or stroke, or even worse. Liver is the key factor of everything when it comes also to regulate and control immune response and also to the emotional nerve system. And most people see the liver just, oh, it's cleaning the blood. And I can tell you guys already now, forget it, that's the smallest thing it does. It also is actually producing most of our important minerals, metals, vitamins, as you know them, and create other amino acids and stuff as an end product of these kind of fusions. When we then talk about the bile or the gallbladder, that is when we're not eating, the liver is actually increasing the amount of bile in the gallbladder. And when we then eat, it's emptied to help our destruction, our take care of waste. The bile is really, really important. Most people that remove the gallbladder then after create systemic inflammation in the large intestines or small intestines, and then also prevent the ability from the small intestine, for example, to be able to work with the protein synthesis. And now when we talk about these pandemic and viruses and such, our protein synthesis is also our microbiota or B cells. And this protein synthesis, or you can talk about mRNA, that is our natural protection. If that doesn't work properly, you open doors for a massive amount of problems in the future. Depending your body strength, it's also depending how long time it takes until you start to get symptoms. This is also what we teach here is, as Renata said, the clinical surgery, how to really feel the difference from a healthy liver to an inflamed liver, because that can get inflammation as everything else. And any organ that have so many functions, and this is only the known one, 500 specific functions, then you have all the unknown that is not ability to measure or sample. We don't even know what kind of test we should develop to find out. But what we do know is the collaboration with adrenal glands, kidney, pancreas, and liver and small intestine is massive. Also with, when it comes to our, as I said, protein synthesis, the lymphatic system, our cardiovascular system, the ability to clean our blood, to make sure that have the right consistency and ability to move nutritions, oxygen to our organs, because the blood is not only blood, it's also actually contain a lot of different cells, transport different cells, to be able to create different fusions in different organs, to be able, for example, to create for women estrogen, progesterone, and other hormones that is very important to also repair different organs and stuff like this. So if any of your doctors say that you should remove the gallbladder, and the reason they do this is if you have inflammation or a non-alcoholic fatty liver or alcoholic fatty liver, That means this communication and liver's ability to produce and fill the bladder with the acid doesn't work properly, and this waste can then become gallstones and create massive problems in form of pain. By using this therapy, remove that active inflammation. You don't need to do this, because everything you remove in the body will create a problem later. One way or another, it doesn't matter what we are thinking about here, because the body is a unit and is massively, by the nerve system, dependent on everything that it works correct. And I can take an example of that is, for example, if you have anyone that is need to amputate an arm or a leg, they still will get a lot of pain, phantom pain, because the nerve system have no brain. So it will try to figure out what's wrong. Why don't we get a return signal? And this massively outgoing signalation of frequencies is then creating pain, because pain is also part of the immune system to tell brain and all our resources, hey guys, you need to fix something here, something is wrong. And to tell us as individual to take it easy. Yes. You want more details?
No. That's good information, and I think you know, if we tell like patients, whoever had the gallbladder removed, you know, it's important for them to understand that they have to have extra care. And you know, I'm always impressed by the number you said to me once, that one medication that we take, one pill that we take, it takes about more than 40 days, right, to be detoxed in the system.
Yeah,
you mentioned something like that.
You could take like this, that one single paracetamol for headache, for example, the poison from that pill stays in our system up to 14 days. And if you take just in sleeping pill, just a very weak one, it can stay up to 1 month in our system. So this is actually creating massive problems for the liver tone. And because many of the pharmaceuticals today we take is also the coating done by different kind of material to actually fool our immune system to pass everything hostile, we don't need this, kick it out. And then it's actually the body take it up, and the liver doesn't recognize this poison. So it doesn't know what, and that will destroy the liver's ability to function during the long run. And what I can see, and many colleagues can see, that this a lot of people today is severely over-medicated and also use artificial supplements or whatever. And these cocktails is still chemicals, how much eco stamps, whatever it is, it's still processed, and the liver doesn't recognize and don't know really what to do with all this. And it comes in so big amount that also create a lot of negative lipids, toxic lipids, not the good ones. And this is so creating inflammation and severe bile problems. And that can lead to big problems. So it can be like you start to getting very easy bloated, you have a lot of gas, maybe enormous fatigue, always lack of energy. You can even start to get groin pain because the kidneys now cannot work properly, because the liver cannot collaborate with the kidney in a proper way when it comes to regulate our ammoniac. And that can create in the long run that E. coli bacteria start to mutate, then you start to get systemic urine infections, and then you are in a very negative circle that will not end if you don't stop to, for example, eating sugar, maybe don't drink alcohol, drink more water, eat healthy. It doesn't mean fanatic one way or another, a little bit shit, a little bit good. Because the body needs the bad things to learn how to take care of the good and the bad waste that we have in those, that we eat. And it's more about really understand how do I do to take care of my body. Because we live in the information society that everything now should be echo, it should be like this, blah, 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 blah. But remember, that never did exist before. And today we have hundreds and hundreds more autoimmune diseases than even existed in the 80s or the 70s. And it's increasing every year. And then we can figure out why is this. And this is, for me, very, very scary. I think I know most of the autoimmune or pathologies exist, but every day there comes new names of things I never heard about. And this is a little bit scary. So whatever you do, take care of your stomach, make sure to avoid things that is not good for your body. That's a good thing to think about.
Yeah, and on your experience, how have you seen patients like who had gallbladder issues after ANF therapy? How do they manage to, once the inflammation is settled, they are fine. Of course, I can tell for myself, as I knew before I had my gallbladder removed, and from now that we have to look into our diet, and our body will tell us straight away when something doesn't do good. We feel it immediately, and it's literally immediately. How is it in your experience? Because I get a lot of patients who come to me they have which we call the red flags, right? So whenever you have a gallbladder stones, like the attack of the gallbladder it's a pain that it's really hard to take. You can have nausea, you can have vomiting, you can have you name it. Normally you have to go to the ER. But I've seen a lot of patients coming to me without having all these red flags, and just because they do a follow-up or a checkup, actually they found out there is some stones, and then they want to be removed. So on your experience, I'm sure you have seen that a lot, and what do you have there to tell us and whoever is in this situation?
No, what we do is when we have this and we examine the liver, and we also go in under the liver and also examine the gallbladder, we feel that it's very, very swollen and it's extremely painful. So what we do is, of course, that we increase the liver function at all, because that is not properly, obviously not working well. And that is when the liver doesn't work well, the bile doesn't work well either. So we need to optimize the function. And that we do by treating the liver with anti-inflammatory frequencies, of course, but also the liver function itself. Because here we have one of the most important organs that we have, if not the most. If you come to the biochemistry function of the human body, the liver is the most important one we have. And then, of course, we apply the frequency, the different disc for all the main function that the liver do. And as I said before, anti-inflammatory treatment. Because here it's about to help the liver to actually start to regulate what it does again. What we do more when we have this kind of patient is that we examine everything that is actually important for the liver function. The kidneys, of course, we support the kidneys with the frequency of the antioxidants, and I don't talk about the one in food. I talk about the one in the biochemistry one that we have in the body, and also for intestinal function. So we're actually treating everything that the liver is regulating normally to help it to make it easier. If you have a patient have removed the gallbladder and doesn't have the bile acid anymore to be able to regulate the bacteria and stuff in the colon and everything else that it does, we of course treat the intestinal function and everything else and try to make it as easy as possible for the body to work for the independent organ that also create the collaboration. So we actually look into everything that has to do with this work that liver and bile is doing, and try to make it as easy as possible to work, even if you don't have the bladder. But you need to treat it as it's there. That means we need to remove the systemic inflammation that could be in the colon or small intestines. We need to provide the frequency of energy for the ability to do so. And we need to provide with the antioxidants that is actually killing and destroying everything that could be a reason for whatever has come. And then, of course, we always tell the patient to increase the amount of water and also to start to eat good food. That means real proteins, that means high quality steaks, medium rare. Avoid everything that is sugar that could damage the liver's ability, and the bile is obviously not there anymore. So we need to remove the sugar that is more dangerous than everything we eat. And that means also fruit with high sugar, like banana, grapes, apples, stuff like
Dates,
this.
yeah.
Yeah. Dates, yeah, I forgot your
That
Middle
it's very, yeah.
That's
It's
the
very
only
common
people
here.
I have problem with to stop with sugar is people from Middle East. I can tell the Middle East people to stop everything, but when it comes to sugar, it's about so
Yeah, and dates, and they're like, oh, really, dates? And you see how much there is sugar in a date. It's a lot. Of course, there
tons.
is good things, but yeah. But yeah, so I mean, I think this is one of the things that unfortunately, you know, that we talk more and more here, that the medicine is stopped doing, is to look for the full complex. So our advice here will try to, you know, find therapists, trying to find either ANF therapists that are near to you. If you don't have any ANF therapists, to try to find therapists that can work functionally and understanding what is happening to the body, why your liver is suffering, why you're creating stones, instead of hurry up and removing the gallbladder. And then, you know, some people remove the gallbladder and say, I'm fine. And I'll say, well,
Yeah,
for how long are you fine? As we know, we discuss always here in ANF therapy, it can take 5 to 10 years to the metabolic thing then turn into a disease. So
or
yeah, I
even
think our
longer.
main method. Yeah, I will just open the comments now if anyone wants to.
I just want to add one important thing also now when
Sure.
we talk a little bit about the female body, that the liver that doesn't work properly, the bile doesn't work properly, is also a reason for infertility, for example. It also can give you breast and ovarian uterus cancer, because these liver toxins is actually a bandit to really many things. And therefore, it's extremely important to keep the liver and everything as healthy as you can. And as you said here, if you don't have an ANF therapist or ANF doctor or whatever close to you, at least you can do is avoid sugar and everything that is fat and lipidation, and maybe also consult your doctor if you're under a lot of pharmaceuticals. Is it really necessary? You need also maybe to think about how much does it really help me, because I think that's a very big point, because sometimes I see a lot of patients that just take medication because the doctor said so. But ask into things what it really does for you. Some medication is probably necessary for your life or whatever. But is it always think, is it something else I can do to improve this without taking any kind of toxins? And I think this is a very important thing. A good dietist can do massive things just to change your diet. Knowledge that we teach here to Dr. Renata and others make even more, of course, because then you get understanding of the biofunction. But I can tell you like this: if your liver work 100% good, your body will produce high amount of glutathione. Glutathione is the only thing that can prevent you from cyst, endometriosis, and cancer. So you can never get these problems if that work 100%. And this is not, this is pure facts. And this is actually how important the liver is. It is very important.
Yeah, exactly. Thank you. That's good saying. So we have some questions here. There's some new people coming and say, how does the ANF treat the body? And also if we can treat heavy metals in the body.
The liver.
Treating the liver, exactly. Yeah, so I think for the new ones, if you can just say a little bit, I can also later send some of the videos that I already made explaining what it's ANF, but if you can just...
Yeah, sure. Now, ANF therapy is that when I started 25, 30 years ago, and what you learn in medical school and everything, you learn everything about symptoms and how to pharmaceutical-wise learn to treat symptoms. But what pissed me off a lot was that nobody talked about the pre-process and stuff like this. And we find out quite fast that the nerve system controls everything in our body. We can actually change almost any organ to artificial organ or many stuff. But if your nerve system stops, we are done. So that was quite easy to understand, that the nerve system is the main system. If that works, we can never get sick. So we start to look into that and measure different parts of the body and find a single organ have a specific frequency. So then I start to connect with a lot of very well-known people inside of function that after discussions and testing agreed to, if we can find a device that can repair the nerve oscillation and repair the nerve, we can never get sick, because that means everything in our body is working under optimization. And but of course it was a dream, because this kind of material or machine, whatever, did not exist. With that said, we can say that highly military, NASA astronauts have worked with the nerve system long time before anyone else did, even in 3,000 years before the Greeks find out the importance of the different neurons. And for many years I was just walking with all this in my head, and one day we met an engineer that said that, and I explained my dream, and we talked about health and stuff, and he said that, oh, we have this material that can do this. And I said, get out of it, it's just blah, 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 blah. Because then everybody would have it. And then we went over to the States and tested it out, and it worked. And so what this ANF is doing is, this little medical device here is made of carbonous metal. And this carbonous metal is a processed carbon in many hundreds and hundreds different heat processes. So the molecule is changing in the disk, so it can be charged, it can reflect, and it can send the frequency. So it's actually we're charging the disk in a very special machine. It's just charge a battery. If that goes out, it's totally the same. So a big computer is programming a special box where they put in, and there they are lying there for a time and charge, and then it's measured afterwards. So it's neurological frequencies that is actually, when you apply it on the skin, it's getting activated from the body's infrared heat, from the sunlight, and the neurological activity in the area where you apply it. So what it then does, it's actually sending a correction signal to the nerve system, depending on what kind of inflammation level it is, or if it's an organ weakness or whatever. So the nerve system starts to learn to copy this frequency. And the good thing is, if you have pain, which is easy to take an example, if you have pain 10 out of 10, take weeks, months or years until you notice the difference. It takes minutes. And we guarantee that, seconds, yeah. I use minutes because it sounds too good, but when you try it, you will see. So we can actually remove any kind of pain from level 1 to 10 inside of minutes. Then how long time does it treat all patients, no matter what they come with? Between 2 weeks to 6 months. And this is because if you tell a chronic patient a date, they will put it in the calendar, and if it's not fixed that date, they will get angry. So, and this is why normally it goes a lot faster, no matter what it is, but the results speaks for itself. And you can see thousands and thousands of videos on Instagram, YouTube, or whatever, what this can do. And it's absolutely medical class 1, so it means no chemicals, no organic substance, nothing enter the body except the pure frequency. So we can treat everything from a newborn baby to the really old person. So this is really nice.
Yeah,
I hope
in
that
the question of yes, yes, indeed, indeed. And then as one more question was about the heavy metals. So, but I think you know the heavy metals, we have antioxidants like the glutathione, the discs that we activated the function of glutathione, and we can work with that as well. And the same person asked if how long it takes for the treatment, and as you already replied, so it depends on each case. We have to evaluate, we have to see, and we find the root cause. That is the beauty of ANF. We are always trying to find the root cause of the issues and not just treating the symptoms. So it will vary from one person to another. I'll open again to the comments, and in the meantime, I don't know if you've seen my post from yesterday that I went for an ultrasound with a new doctor, and she was so surprised. She's like, what is this scar? And I started explaining to her, and as she was doing the ultrasound, she's like, I can't believe you had all that. Like, your liver, it's so beautiful, it's so healthy, and you know, your intestines are not suffering. Like, I can see there is no adhesions. There is, like, I can't believe you had so many surgery. So again, I'm forever thankful to you, to ANF. I'm a big fan. As I tell my patients, it's literally a miracle. I have my baby now here almost 1 year, and she's like, wow, you didn't have the baby. I was like, yep. She's like, I want to know what is this discs, and I want to know what they do. So yeah, it's incredible, and it's hard to explain without feeling it. It's just when you take the therapy, and then you can really understand what it does. Okay, so
no, I say that,
we have
I
just
remember what you looked like when I met you the first time. So it's a big
yes,
yeah.
on the first time
Yeah, when I met you the first time
sorry, say that
during
again?
education. Yeah, when I met you the first time during the education Dubai, and how you looked then and how your body was compared to now is one hell of a difference for sure.
Yeah, and I remember the first time I was really, and I'm so, as you said, I'm the most skeptical, you know, scientific thing, and I'm like, this can't make sense. Like, I've been 30 years of my life looking for answers, and this guy come and he tells me that he has all the answers. This skeptical, but as I was learning, just trying to help myself, I was getting more and more #1 fan of it, and forever thankful. So one more question here. So before we end, it says, do these stones build up over a period of time, or they can come suddenly and quickly?
No, they
About gallbladder stones.
Yeah, they build up during because it's actually waste products that become crystals, and if the bile and the liver cannot take care of it, let's say that bile acid is not strong enough to break down, it's the same. You get calcification in vessels and vein in the blood that can give you stroke, and here is the same in the bile. What happened is that when it fills up the bladder with the bile and then release to help the intestines and stuff, but it fills up and just doesn't release totally, so it totally empty the bladder. A little bit stays there to the next time, and this waste product can be crystallized, and that means every time the bile should be open to release through the bile vessel, it just stuck. And because most people know that the nerve system is what I see on this chart, but you should know every single organ have their own nerve system that is connected to the main system, the same as lymphatic system and blood system. And this means because the body's way to tell something is wrong is to create pain. And that means at the same time as you go and hit your knee in the table, when something is not working, it appears acute inflammation ASAP. And that means now we are dealing with Breckenine, lymphocytes, or whatever, and you get severe pain. And this is the body's way to communicate to the resources we have to try to fix the problem. But the problem is also that when you have these crystals, it's been there for so long time, and maybe they get many small stones that then when you try to enter the vessel, it cannot do like it. So this, now the bladder is going whoop, and create massive amount of pain. So what we do with gallstones when we talk about ANF is that we apply extremely strong frequencies to actually burn it to pieces. And that works the same way that extreme high frequency disc we have work in the same way as laser therapy for cancer. It's the same principle. So that's what we do also if it comes to kidney stones, and that is the same reason but in a different organ. So just stay away from sugar, reduce the fat in food, stuff like this. Maybe use oil to good oil wood instead of butter if you do that. Stay away from everything that's high amount of sugar. Eat properly. When we talk about heavy metals and stuff.
The internet is cutting. Sorry, the internet is cutting. Just.
Yeah, I can see it's going on off. Yeah. Do you see me or hear me?
Yeah, I think now we're back.
Yeah. Okay.
Yeah, it's a little bit of a delay when you're talking.
Ah, it's because I'm sitting in.
Okay, let's try again. It was a little bit of a delay.
Ah, now you're back.
Yeah. Okay. Yes. Now I can hear you again.
Yeah. No, so I hope you guys got this, but so that is what we do, and the good thing again is that you notice as the effect immediately, and also the reason I chose to give this therapy to clinics that work clinically with patients is that you as a patient, or if you're a healthcare professional, can provide and give the patients everything from rehabilitation, manual therapy, whatever tool you need to do, they can get, and also answers. Because here, if you are a professional in healthcare and interested in this, we teach you the biofunction of the human body, how to understand the source. And this is not the symptom, because that is the first thing you learn here. Don't trust the symptoms, find the source. And I think also for Dr. Renata made a big in her clinic and works with this. And I think that is key point as a patient is to go to a place where you get things explained and they take time and not like 7 minutes or whatever.
Oops, it's yeah, it's cutting a little bit, but yeah, we're gonna be back. I hope in few days. I mean, in 15 days or so, if we can do 1 or 2 lives per month, will be awesome. And then we'll keep talking about all that. It's so much information that we have to keep it here available to patients, and they understand that there is hope. You know, everything, you have to try everything because before go to surgery, because surgery is the last resource. We're not saying that don't have, sometimes you have to have, but
Sure.
try everything possible and know that there is light at the end of the tunnel. So we're going to come back to talk a bit more about gut, I think, but let's see, you send us questions and so, and in 15 days we will be back to answer more questions and to be chatting again. Thank you so much for being here.
You're welcome.
For all the talk as
I
usual. I always end up learning as well.
Yeah, and if any one of you that see this and maybe you have a subject you're interested in, you can send it to Dr. Renata, and we sure can do something about that as well. So I thank you, Renata, for doing this, and it's a big pleasure to be able to maybe give some answers to people that wondering or nervous or whatever, as much as possible we can. And I'm here, so whenever you need me, it's a big pleasure.
Thank you so much. We have a question here about the, what do you think about the COVID? And that's a big discussion that I would love to talk here about, but I'm not so sure how they will let us go with this discussion. But that's a very interesting thing going on around the world. And the best thing we can do is to keep with preventing. I'm constantly, because I'm seeing patients at the clinic and having the baby at home, I'm using the prevention. Had some friends who benefit while having COVID. They benefit having the discs on. And what we can tell you, if one thing we can tell you, if whatever your decision is, the discs can help you either if you take it or you don't take it. Always have the protocol before and after, or while you know, trying to detox. Anyway, it's a big discussion. We're going to leave it perhaps for another time. We can try leave a video and see if it stays on. But yeah,
I would love
good.
to give,
so thank you so much.
For sure.
For some reason we're losing you. The internet,
it's probably,
I can't hear you.
Yeah, no, I say that I would love to take that discussion up and give the different vaccines, what they do and not do, and what you should think about. And I think this is, in these times, very important. A lot of people is really, really afraid of this virus. And I say like this: if you have normal health, you don't have any lung issues or neurological issues or cardiac issues, don't worry. It's a bigger danger to go over the street and to get COVID. Media have succeeded to create massive fear and stuff like this. But let us save this for another time, and then we can go in detail about that. I also did a lot of videos of it here on Instagram, but you can see, and it's very interesting.
Exactly. It is. It's a deep. And I'm sure we're going to be like 2-3 hours discussing about that. We can try. We can try another talk, perhaps in a few days, and let's see how it goes. Thank you so much once again, and we'll be in touch.
And have a nice weekend.
Thank you. Thank you all for watching, and don't forget to share the video so it can help many other people.
I will.
Bye for now. Bye.
Bye-bye.